All right, sorry about that. Hey everyone, sorry about the technology issues. It's well, I can sit in my basement with pajama pants on, but at the same time, it has its issues. So I'm Colin Champ. I'm a radiation oncologist at AHN. I head the breast oncology group for radiation oncology, and I run the Exercise Oncology and Resiliency Center. I'm from Pittsburgh originally. I used to work for the University of Pittsburgh, left and went to Duke, and then last year left Duke to come up here and run this program. So really excited to be back in the Berg with my people. So thanks everyone for being on. And what I'm going to talk about is, I did switch the title up, so I apologize for that, but the 5 pillars of exercise oncology. I think this is a little more of a tangible takeaway type presentation. So I hope you like this a little bit better. And what I'm going to go through are really, when you think about exercise oncology, or what you should think about from an exercise point of view, particularly with breast cancer. These are the 5 points that I think are most important. So I'll try to breeze through this and leave some time at the end so we could chat. But why exercise during or after breast cancer? So there's a lot of reasons. Mental benefits, we all know that's the case from exercise, getting out of the house, etc. But there actually may be a direct benefit from our diagnosis. And this is a large paper from the JNCI 2021, over 1,300 women treated for breast cancer. What they found was that 1 year after treatment, if you look on the top right here, the green line, there was a 40% reduction in breast cancer recurring and a 55% reduction in these 1,300 women dying, basically, in those individuals that were active in that exercise. And by year 2, that actually got even larger. So that recurrence risk dropped by about 55%, and the risk of dying dropped by almost 70%. What's fascinating about this is, we know that people more active generally live longer. So this could have simply been an artifact of that. But when you look at the data, the fact that people that were more active had a lower risk of recurrence tells us that there's something specific to cancer that's going on with exercise. And if you look at the bottom right, when they compared low activity levels, that's in the green, moderate activity levels, and high activity levels in the pink, this is for those individuals exercising, there's a benefit for all of them, almost a 60% benefit in reduction in risk of dying. But in those individuals that were highly active, that benefit increased to 70%, so significantly more.
I'm sorry, Dr. Champ, but it doesn't look like the slides are advancing.
Huh, okay.
There they go.
They are. Is that better? Can you
Yes.
see the whole slide?
Yes, but we see your slide deck on the side too.
Yeah, I did slideshow. Is this not showing it?
Yeah, you're fine. It says activity levels, recurrence, and mortality.
Yeah,
Okay.
yeah, exactly.
Okay, good. Thank you.
All right, thanks. Let me know if it's not working after this. So exercise is great for all of us. It's great for individuals undergoing treatment for breast cancer. It's great for individuals after treatment for breast cancer. But what is exercise, right? What is activity levels? Is that fishing? Is that going for a walk? Is that, going to the gym and walking on the treadmill? Is it going to the gym and not doing anything? So when you dig deeper, there's quite a bit of data that tells us what exactly that exercise should be. And don't get me wrong, any kind of activity is good. I'm not poo-pooing that. We should all be walking. Walking is breathing. We should be walking every day. We should be walking miles per day, even when it's snowing out. Like right now, we should be going for walks. But in terms of the 5 pillars, number 1, this is the most important factor that we're seeing again and again for women with breast cancer, and that's body composition. That's muscle mass, adipose tissue, and both of these correlate with breast cancer outcomes. This is another big study with 3,200 women with stage 2 and 3 breast cancer. This was published in JAMA. And on the top right, what they found in these women is those that were sarcopenic, orange line there. And sarcopenic means you have low amounts of muscle mass. they lived significantly shorter than those women after treatment that were not sarcopenic. So women with higher amounts of muscle mass lived significantly longer. So this isn't just saying exercise is good. This is digging down. There's something about having more muscle that's good. Conversely, when we looked at the bottom right, we found that women in 3 different tertiles. What's that?
The slides aren't advancing.
I'm still in that same. Can you see body composition?
No.
Man, that's bizarre. So if I go out of presenter mode, it'll advance, but when I'm in presenter mode, it looks like it doesn't advance. Can you guys see this?
Body composition.
Yes.
Yeah, I'm gonna have to show it this way, like I'm one of these old docs that doesn't know how to use PowerPoint. But if I do the slides, it won't show it. So I'll just keep it this way. So I hope that's all right. So back to the top right, those women that were not sarcopenic, i.e. had normal or high amounts of muscle mass, lived longer. On the bottom right, those women with high amounts of adipose tissue versus those women with low amounts of adipose tissue lived significantly less. So less fat, more muscle is associated with significantly higher rates of survival after breast cancer treatment. So why is that? Well, there's 2 easy ways to describe it. On the left here is, and there should be 2 pictures here, muscle and fat. On the left here is muscle fiber. When we have more muscle fibers, when we contract that muscle fiber during exercise, it secretes a whole slew of hormones. A lot of these hormones are anti-inflammatory hormones. One of those, a very important one, is muscle-derived IL-6, interleukin-6. That and other hormones secreted from the muscle do things like burn adipose tissue, make our bones stronger, tell our gastrointestinal tracts to work normally, help with our pancreas and insulin secretion in our metabolism. And from a cancer point of view, around the middle, the top right here, it increases neutrophils and lymphocytes and macrophages. So it improves our immune function. On the far right here, you have adipose tissue. Adipose tissue basically does the exact opposite. So while it's highly necessary, we all need adipose tissue. Too much of it can secrete hormones like estrogen, a lot of inflammatory factors, and it can mess with our immune system. It can dysregulate our metabolism. And then on the bottom right there, the far bottom right, it can cause inflammation and immune dysfunction. So tumor necrosis factor, interleukins, VEGF, these things that can fuel cancer cells. So I look at muscle and fat almost in an antagonistic way. So the number 2 in the pillars is muscle mass. So is your exercise regimen increasing muscle mass? There's only one way to increase muscle mass, and that is through resistance training. So 2 slides ago, muscle mass is important. There's only one way to increase muscle mass, resistance training. You need to stress your muscles. You need to tear your muscles. You need them to grow back stronger. And we know there's 2 main ways to do that. The slide here on the left, this is a change. The y-axis is change in squat strength, and the x-axis is change in muscle fiber. The stronger you are, the heavier you lift, the more muscle mass you have. That's been shown again and again. It's a direct linear equation or graph. And then on the far right, we know from a whole slew of studies, including a meta-analysis, that is based on number of sets. So when you go into the gym, if you do 1 set of every exercise in the gym for 30 reps, which is what a lot of people recommend, you're not going to build muscle mass. It's almost like a cardio workout. What we do know is that if you look on the top right in terms of bicep thickness, and then the bottom right, this is quad thickness. If you do 1 set, you can get some benefit. If you do 3 sets of an exercise per week, you get more of a benefit, 2 to 3 millimeter muscle gain. And then on the bottom right, if you do 5 sets of an exercise per week, you get up to 7 millimeters on average of muscle gain. So what this means is, much like radiation, if you're treated with radiation for breast cancer, your radiation oncologist better get to a certain dose or else it's not going to work. We see the same for exercise. We have to prescribe a certain dose of exercise, and as long as we reach that dose, we can get improvements in body composition. what we've seen, unfortunately, over the past, actually almost 2 decades, if we look at what's required for hypertrophy, and what's required for hypertrophy based on meta-analyses on a whole slew of studies, is what I just showed you, at least 5 sets per muscle group per week. An optimal threshold, and this is what we try to get at our gym, is 10 sets per muscle per week. So 10 sets per muscle per week is going to get you pretty darn sore in the first 2 weeks. And I think I saw Mary speaking up on the screen there when I was muted. And if you don't believe me, you can ask her, because I think we got her pretty sore that first week. But what we found was when one of my students, this was published 2 years ago out of Duke, when one of my students looked at all the studies that existed in breast cancer patients. The purple line here is per the 5 major movement patterns, how many of them achieved the optimal hypertrophy volume, and the blue line is how many achieved the minimal. So that's 5 sets per muscle group per week. The hashtag here means they didn't even report what they were doing, what the exercise regimen was. So think about going from, we need a certain dose of exercise, to not even saying what exercise you're prescribing, just saying you did exercise. As you can see here, very few of these, actually only one of them actually reached that 10 sets per muscle group per week for all 5 movement patterns. Otherwise, a couple of them reached it, the 5 sets per muscle per week. But this is why there's a whole slew of studies now, saying there's something about breast cancer, women with breast cancer, they don't make muscle. Well, if you look at these studies, you wouldn't expect them to make muscle, because we're not hitting that threshold. We're not hitting the dose that's required. So looking at the studies that exist, 30% of them didn't comment on the exercise regimen. 50% of them employ an exercise regimen that is identical. So think about that. Every person that comes in the door gets the exact same exercise regimen, whether you have a bum knee, a bum shoulder, weak bones, strong bones, it doesn't matter, you're all doing the same regimen. What we like to do is we base it on a movement pattern. So everyone does the same movement patterns, but based on your ability, we will do a progression or a regression. Example of that is everyone should split squat. I don't care if you're 20 or I don't care if you're 90, you should split squat. It's one of the best workouts you can do. If you can't split squat, you can hold a staff while doing it. If you can't hold a staff and do a split squat, then you can do a ball squat on the wall. When you get really, that's a regression. When you get really good at a split squat, you can do a progression. You can raise your back foot, have it elevated, and have kettlebells on each side. That's a rear leg elevated split squat with kettlebells, and that's a grueling, pretty darn good workout. Everyone should hex bar deadlift. If you can't do it, again, we regress it. If you can, we progress it. We throw some weight on. We have every person to our facility has hex bar deadlifted. We have another facility in Florida. I was there last week, and I watched a 85-year-old woman who probably weighs about 105 pounds hex bar deadlift 140 pounds. So everyone on here can likely hex bar deadlift. And there's not something unique about breast cancer patients that mitigate the benefits of exercise. Our dose has just not been high enough. And we've written several papers now calling for targeted and dose escalated resistance training. And I'll speed up a bit here since I took so much time. Sorry about that. Going backwards. All right, number 3, is this exercise regimen helping with metabolism and fat management? This is a slide on the y-axis is energy expenditure, so how much energy you burn, and then the x-axis is during the workout. So obviously at rest, we're not burning any exercise. During the workout, we burn a ton of energy, actually probably less than you would think, but we burn a good amount of energy. And then after the exercise regimen, and this is particularly profound when you do muscle stimulating, resistance training, muscle pumping type exercise regimens, your fuel tank will be running on low in terms of oxygen. You actually have this thing afterwards called post-exercise oxygen consumption, excess post-exercise oxygen consumption, EPOC, EPOC. You basically hyperventilate for hours afterwards to make up for that oxygen that you used while tearing those muscles. And this is why when we had to wear masks, well, we still have to wear masks in the hospital, it drives me insane, because if you work out in the morning and you do resistance training, you feel like you're in a sauna when you're breathing into that mask because you don't even realize it, but you're hyperventilating. This has been shown again and again. And the study on the right here is really one of my favorites. When we looked at, in terms of metabolism, i.e. kicking on the pancreas, kicking on our insulin sensitivity, lowering blood. I have a bunch of pictures supporting what I'm telling you. So now that you can't see those pictures, you're just gonna have to believe me. What I was talking about before it logged me off, basically there are studies comparing aerobic training, like running on a treadmill, with resistance training. And resistance training shows a significant, they both show a benefit. Resistance training shows a significant benefit in terms of lowering our insulin levels and our glucose levels. So we know our metabolism is working better when we have less sugar floating around in our blood because we're much more insulin sensitive. We're sucking it up. We're burning it for energy. And along those lines, there's a whole slew of studies showing that you can exercise and exercise and exercise. And in fact, one of the researchers that I worked with down at Duke did a bunch of studies with these Hadza hunter-gatherers. And basically what he showed was the more active you are, the more your metabolism basically slows down to offset it, right? You can't exercise off a bad diet. You can't exercise off weight. It just doesn't work very well. You want to build muscle, and we know that muscle mass correlates with metabolic rate. So the more muscle mass you have, the higher your resting metabolic rate is. And while I'm not a calorie counter, the more calories you will burn at rest. Okay, it's your furnace. So if you think you're going to go to the gym and run on the treadmill and burn off all your calories for the day, you're going to be disappointed because it's a fool's errand and it just doesn't work. It's so hard to burn that many calories in a setting. So I don't view going to the gym as burning calories. I view it as building muscle, getting stronger, and I'll tell you some other things in a second here, and then gaining muscle to increase our metabolism throughout the day. All right, we're going to the gym to improve our metabolism 24 hours a day, not to burn calories for the 30 minutes that we're there. All right, and then I don't even remember what pillar I was on, but okay, I cheated. I went to my slide. So number 4 was falls and fractures. And this is the most important thing that we all overlook. So I'm basically middle-aged at this point in my life, sad to say. Even though I have 2 young daughters, I was late in the game here. But we're all at risk for falls and fractures. So we're all at risk for muscle loss, especially when you turn 40. Beyond 40, it just gets harder to keep muscle on. We also, our neurons don't fire as well, partially because of the muscle loss. And we know that risk of falls, especially if you were treated for malignancy, treated with chemotherapy, treated for breast cancer, the risk of fall is 5% per year. Okay, so 1 out of 40 of us on this call will fall this year. The risk of us fracturing our hip is about 0.5%. The risk of us fracturing our vertebral body is about 0.5%. And those are, you fall and break a vertebral body, you fall and break a hip, those are career-ending, potentially life-shortening or difficult time the rest of your time here on Earth type of fracture. And the risk of any fracture after a cancer diagnosis and treatment is about 2% per year. So about 1 out of 20 of us are going to fall, and half of that one, so 1 out of 40 of us are going to break something when we fall. So what are we doing to prevent falls? The medical field, which I'm part of, really does nothing, right? A lot of women on this call are on Arimidex or tamoxifen, which weakens the bones even more. A lot of women on this call are postmenopausal. So you take a postmenopausal woman, you put her on Arimidex to basically zap any additional estrogen at that point. Your bone loss is very high. Your risk of fracture is huge. So A, what are we doing to help with that fracture? B, what are we doing to stop the fall? The best way to decrease the risk of falls is through lifting heavier weights and compound movements. You should lift like you're a professional athlete, like you're a linebacker for the Steelers. You want to get quicker. You want to be able to move sideways. You want to stop yourself should you fall. And that's low reps, high weight. In other words, stuff you don't want to do at home, stuff you want to come in and have a CSCS, a certified strength conditioning specialist, like myself or Frank if he's on, or one of Frank's people. These are compound heavy lift movements. These are what keep your neurons firing, what increase your sensory neurons, what increase your motor neurons, make them fire smoother, and make those muscles contract smoother as well. That's what keeps you from falling. The good news is that's also what keeps your bones stronger. So I have a great picture here. I think it's great. I made it, so maybe it's not actually great, but I'm proud of it. And unfortunately, you can't see it. But if you think of the bone, your bone looks like Swiss cheese, right? On an X-ray, your bone is solid white. If you look under a microscope, it looks like Swiss cheese. When you stress that bone to 10% of the stress required to break the bone, it causes microfractures in the elements of the Swiss cheese. What happens is when your body senses those fractures, the cells or the osteoblasts wake up, they pull in calcium, they pull in collagen, and they start laying down bone. But only when you hit 10% of the stress required to fracture a bone. So if you go to the gym and grab 1 pound weights, or as my daughter calls them, Mimi weights, she calls my mom Mimi, and those are the weights my mom has in her living room. So she lifts her Mimi weights. If you lift Mimi weights in the gym, it's not going to cause bone density. It's not going to increase bone density. You have to stress your bones to the nth degree. And again, we want you to do that safely. So you should do that in the presence of someone who really knows what they're doing. But again, and this is the number 5 pillar, are we stressing our bones? We're all at risk for fractures. We're all at risk for falls. The only way to offset that is to do compound lifts. So not sitting at the leg extension machine, doing this with your leg. It's grabbing weights, grabbing a kettlebell, goblet squatting it, squatting down as low as you can go. It doesn't have to be to the ground to start, but it should get there eventually. That's the only way you're going to do this. So any activity is good, but if you're going to go to the gym, you need to stress the heck out of your muscles and you need to stress the heck out of your bones. So the last thing I'll say, and then we can start chatting, is what we do is we look at exercise as medicine. So we measure it as we would anything else, right? If you have breast cancer, well, if you're a woman with breasts, you get a mammogram, right? You have a 1 in 8 chance of getting breast cancer, so you get a mammogram. If you were treated, you still get a mammogram, right? We're making sure what we did works. So we do the same. So we should be measuring muscle mass, right? You can do it with an ultrasound. You can do it with bioimpedance analysis. We should be measuring strength. We should be measuring bone density. You're probably all, or at least most of you are getting DEXA scans. You can measure that as well. You can measure metabolism. We have a mask that actually calculates oxygen in and CO2 out. So the key here is viewing exercise not as some checkbox where we don't even know what it means, but exercise as a prescribed regimen with specific goals that we can achieve. And that's basically what we do at our facility. That's the crux of my passion in life and my research. And that's what I would hope that you all spend some time during the week doing. Any activity is good. As much activity you can do is great, but you got to lift some heavy things a couple times a week. And I'll stop it there. Sorry for all the multiple tech issues.